Alright, so today we're talking about round ligament pain during pregnancy. Most of the time this starts to occur later in pregnancy, although you will feel some discomfort early on as your uterus really starts to grow. So for me, I felt it really early on when I was coughing, sneezing, using the restroom and things like that. But it is usually felt as a very sharp, intense, quick pain that can occur on one side or both sides. Usually when you get up from a seated position, rolling over in bed, or when you're coughing and sneezing. So the pain is due to stretching of what is called the round ligament. So the round ligament is a supportive ligament of the uterus. So as your belly grows, baby grows, you get that extra stretch. And then when we go and sneeze, cough, or get up, we get an increase in that stretch, and can cause some sharp pain and discomfort. So in the office, treatment for round ligament pain, there's a lot of muscle work being done to the ligament to kind of help stretch that out, as well as chiropractic adjustments to help the hips and the pelvic, make sure they're aligned, and then giving you some at-home stretches and exercises and things that you can do to kind of just lessen the pain a little bit. Some things that you can do at home are you can manually massage that area as well. So we're looking around the pubic bone, the hip flexor, and that belly button, and we're just going to circular motion kind of up along that 45-degree angle just to kind of help keep it nice and loose. Changes that we want to be aware of is stacking our chest. So we don't want our rib cage too far forward, and we don't want our rib cage too far backwards, because when we get too far backwards, we're going to get that extra stretch on that round ligament. So we want to make sure that in that standing posture, we are stacking our chest and our pelvis. Another thing that we want to focus on is when we are rolling over in bed or getting up out of bed is to do a lumbar roll. So instead of kind of using our abdominals to get up, we want to roll to one side and use our arms to push ourselves up. Same thing when we are getting ready to cough or sneeze. We can either bend our legs closer to our chest. If you have a pillow or something handy, kind of squeeze that pillow and then cough and sneeze. It'll just take a little bit less pressure and give you a little less stretch in that round ligament. And then the next thing you want to focus on when getting up out of a seated position is we can pre-stretch that ligament. So what that looks like is when we are in a seated position, we take the leg, the same side of that leg that you get that discomfort on, and we're gonna pull it backwards. And then we're gonna just lift our chest a little bit, and you should feel a nice deep stretch along that round ligament and into that hip flexor. So pre-stretching the ligament before we get up out of a chair will help kind of decrease that pain. And then when we go to get up out of a chair, using our arms to push us up.